So the newest COVID variant that is in the news that's under monitoring by the World Health Organization and CDC is called BA.2.86. And the reason that it's in the news is because it's several mutations different than the strain that's in this upcoming COVID vaccine. The good news is there are studies now that show that this new COVID vaccine still provides antibody protection against this newest variant, despite the fact that it's a little bit different than what's in the vaccine. For the new COVID-19 vaccine, they really want to make this a simple issue. Everybody that's 6 months of age and older, just like the flu vaccine, is eligible to receive the new COVID vaccine. In the safety trials looking at this new COVID-19 vaccine, there are no new side effects that are noted. It's based on the same platform. The only difference is that it has a different viral strain, which matches closely with what's circulating now. So really, it's an updated strain, but the vaccines themselves are unchanged. And so they haven't noted any new significant side effects with this new vaccine. It takes about 10 to 14 days after receiving the COVID vaccine before your immune system is able to ramp up that immune response to provide protection for most people. So you should really keep in mind that once you get that vaccine, it's still a week or two before you're going to have full protection. It's important for everybody to get the COVID vaccine because, as we know, the infection rates can kind of climb and go down a little bit. We have difficulty predicting when we'll see more cases. For this past week, we saw a slight decrease in cases, but it very well could go back up again. And we anticipate that we'll see more cases again. Even if we do see a continued decline now, we anticipate we'll see more cases again in the wintertime. You can switch from the mRNA vaccines to the newest Novavax vaccine product if you want to do so. Right now, the Novavax vaccine has ACIP or CDC approval. It's still pending FDA authorization, so it's going to be out a little bit later than the Moderna and the Pfizer mRNA vaccines. With the end of the public health emergency, there is now no longer that same vast supply of purchased vaccines by the federal government. They're really moving out of the pandemic to the endemic phase, similar to the flu vaccine. So really now people will get the vaccine similar to they get the flu vaccine. Insurance companies will cover it. Depending on your insurance, that coverage may vary. There is a program out of the federal government is supporting called Bridge Access Program, which will help to provide COVID vaccine for people that are uninsured. And that'll be largely through public health departments and other federal partners. A lot of people have had COVID infection more than once at this point. Some people 3 times, some people potentially even more than that. The problem is that you can still get another infection because protection from natural immunity doesn't last very long. And also the other problem is that repeat infections may be more severe than the prior infections you had, or could lead to a case of long COVID, even if you haven't had that before. And so it's important for everybody to get protected with the vaccine to really reduce the risk of kind of these worst case outcomes with COVID infection, ending up in the hospital or dying or developing long COVID. And vaccines can help protect against those risks. They are trying to simplify the strategy with the COVID vaccine. The COVID vaccine schedule got a little bit complicated, and really they're trying to move to a 1 dose once a year for most people to really simplify that and make it easier for people to fit into their normal lives. They are looking at a combination of COVID and influenza vaccine, largely because everybody 6 months of age receives those. And so that makes more sense to pair those together. And now that we're looking at COVID vaccines likely once a year, it makes more sense to try and pair it now. Earlier, it was a little complicated because of the lead-in schedule for COVID vaccines was a little bit different from the flu vaccine. Pfizer mentioned recently that they don't anticipate they'll have that combination COVID vaccine product until 2025. So unfortunately, there's going to be a little bit of a wait, but there really is a lot of interest in combining COVID and flu vaccine to really improve the convenience and uptake of those vaccines for everybody on an annual basis. So the good news this year is that there are 2 different RSV vaccines. They are indicated for people that are 60 years of age and older. And so it's recommended that if you're 60 years of age and older, you talk with your doctor to see what risk factors you have. Most people should get that if they're 60 and older. We see that there are RSV infections in a pretty good number, and people 60 years of age and older tend to have more severe illness with RSV. You can get all of the respiratory virus vaccines at the same time. So there's 3 of those if you're 60 years of age and older: RSV, influenza, and COVID-19. If you're less than 60, you can still get the COVID-19 influenza at the same time. It's a lot more convenient. You can get those in separate arms. There's no problem with having an immune response by getting them both at the same time. The question of masking has been evaluated pretty closely. What I would recommend is that everybody should do their own risk assessment. People have different tolerances for risk. Right now, we're seeing a lot of COVID-19 transmission in the community. I would recommend, if you're at high risk for complications or severe illness from COVID-19, meaning if you're over 65, if you have underlying medical illness, if your immune system is compromised from medications or underlying illness, I would recommend wearing a mask, a well-fitted, high-quality mask if you're going to go into a large, public, crowded setting. I would definitely consider that because there are going to be people in that setting that have minimal or asymptomatic COVID-19 that potentially transmit to you. So wearing a mask would be a good idea for those people. I think everybody needs to do their own risk assessment and determine what they want to do. RSV is a challenge, particularly in children, and particularly our youngest of children, less than 12 months of age. One of the things you can do is to try and keep your kids away from other sick kids. That's a lot easier said than done. We really want people that have sick kids to keep them out of school until they're better so they're not transmitting, help to try to reduce some of the community transmission. There is a new product that's available that was just approved this summer by the FDA called nirsevimab, which is a long-acting monoclonal antibody, and that's indicated for infants that are less than 8 months of age entering the RSV season, so starting October, which is really right around the corner, to receive this long-acting monoclonal. It lasts for about 5 months, so that's about the length of the RSV season. So there is now a product available for our youngest of children at less than 8 months of age that are at the highest risk for severe RSV infection, hospitalizations, and bad outcomes. Some people choose to space out their vaccines, and that is understandable. Some people want to have one vaccine at a time and deal with potential side effects like sore arm, one at a time. There is not a problem from the immune system's standpoint of getting them all at once. My biggest concern when people space out their vaccines is they may not return for all of the vaccines that they need, that they qualify or are eligible for. And so you don't want to miss out on that opportunity. So that would be my biggest concern if someone were to space them out, is that they don't miss out, lose that chance to come back and get all of the vaccines that they should to keep themselves protected. The general recommendation for use of the COVID vaccine, as an example, since there's a lot of people right now that are recovering from COVID infection or had one recently, is that you can wait about 12 weeks or 3 months after that infection to get that COVID vaccine. That's really to get the best immune response. There's no concern from a safety standpoint from getting it even immediately after getting COVID infection, but you're going to get a better immune response if you wait a little bit of time for your immune system to be able to settle down some and really respond to that vaccine. So the government's been very careful to clearly call this a new vaccine and not a booster. And that's because this new COVID vaccine does not contain the original strain. It's the first vaccine that does not contain the original strain. So it's not boosting on the prior responses you may have had from receiving vaccine in the past. This contains a new vaccine strain that hasn't been in COVID vaccines before, and that's why they're calling it a new COVID vaccine. They're also working to transition to a simpler strategy where people get one COVID vaccine probably once a year, similar to the flu vaccine. So we talk about the new flu vaccine every year. We don't talk about flu booster for the same reason. And that's what they're trying to go with this more sustainable strategy for the COVID vaccine.
Hello, everybody. Stefania Jimenez here. Thank you so much for watching KSAT's YouTube channel. Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.